Hello viewers, this is Dr. P. Mary Anupama, Head of the Department of Biochemistry, St. Joseph's College for Women, here with the topic Importance of Glomerular Filtration Rate. The contents of this lecture will include basic introduction, what is glomerular filtration rate, the mechanism of glomerular filtration, regulation of glomerular filtration rate, importance of GFR, and the consequences of abnormal glomerular filtration rate. We are aware that kidneys, they are the main organs which filter the blood and they remove metabolic waste from the body. They help maintain homeostasis, that is a balance. This is responsible for maintenance of a good internal environment. So glomerular filtration rate, this is a key indicator that tells us how a kidney is functioning. So GFR, it shows the efficiency at which the blood is filtering at the nephrons. The filtration basically takes place at the renal corpuscle, the cup-shaped one of the nephron. So filtration, it is the first step in urine formation, and determining glomerular filtration rate, it helps us to assess the normal functioning of the kidney or to even identify the diseased conditions of kidney. Let us know about glomerular filtration rate. So glomerular filtration rate, it is defined as the volume of filtrate that is formed per minute by a nephron. So this measures how much of filtrate is formed from the plasma into this Bowman's capsule. So normally glomerular filtration rate, it is about 125 ml of filtrate which is formed in adults. If you calculate it per day, it is almost 180 liters of filtrate which is formed. But the amount of urine that we excrete is very less. So most of it is reabsorbed and very little of it becomes urine. The glomerular filtration rate, it depends upon factors like the pressure that is exerted here, the permeability of the membranes, and even the surface area. This is the determination of GFR, glomerular filtration rate. It indicates how the kidney is functioning, that is, kidney's filtering capacity and even efficiency. Let us understand the mechanism of glomerular filtration. So glomerular filtration, it basically occurs in the glomerulus within the Bowman's capsule. So glomerulus is nothing but the bunch of capillaries which arise out of the efferent arteriole. So this glomerulus, it exits via the efferent arteriole. As the blood, it is pumped at very high pressure into this glomerular capillaries, this becomes the driving force for filtration. So what happens here is small molecules like glucose, salt, along with the water, urea, they all enter into this capsule. While larger ones like proteins, all the blood cells, they remain in the blood only. So this filtration which is taking place here, it depends upon the opposing pressure. There is also an opposing pressure within the glomerulus. So the hydrostatic pressure which is there, that promotes the filtration. We also have osmotic pressure, capsular pressures, that are the opposing ones that determine the glomerular filtration rate. What regulates glomerular filtration rate? So regulation, first one is autoregulation. Here it maintains a constant glomerular filtration rate. The work, it depends basically on the blood pressure changes within the individual. GFR is an intrinsic kidney mechanism. It operates intrinsically. The efferent arteriole, that adjusts its diameter according to the blood pressure changes and regulates the glomerular filtration rate. Along with this, we have tubuloglomerular feedback that is also involved in autoregulation. Thereby, it ensures that a stable filtration is taking place. Next type of regulation is hormonal regulation. Hormones, they also regulate the glomerular filtration rate. GFR, it is very much activated during stress or when there is low volume. We have RAS system, that is angiotensin renin system, that reduces GFR. Hormones, they also cause vasoconstriction and thereby there is conservation of body fluids that is taking place. Even ANP, it increases the glomerular filtration rate. Coming to the neuronal control. So there is also neural control, which is basically by the sympathetic nervous system. This gets active during shocks and during stress, which causes vasoconstriction. During shocks or during stress, it causes vasoconstriction, thereby reducing renal blood flow. This in turn decreases the glomerular filtration rate, and the priority would be pumping blood to the vital organs. So this is how these three systems, they are regulating GFR, that is autoregulation, hormonal regulation and neural control. Now let us understand the importance of glomerular filtration rate. First one is indicator of kidney functions. GFR, it is considered as the most reliable indicator that indicates the functioning of a kidney. A normal GFR, it reflects efficient filtration, while a reduced GFR, it indicates an impaired kidney functioning, that is, it indicates kidney damage. GFR is used to diagnose kidney diseases, monitor their progression, and also evaluate the efficiency of treatment. Second one is regulation of waste removal. The primary function of the kidney is removal of metabolic waste, which include metabolic products such as urea, creatinine, and even uric acid. Glomerular filtration rate determines how efficiently these wastes are removed from the blood. Any decrease in the glomerular filtration rate, it leads to accumulation of these substances, resulting in toxic conditions like uremia. Third one is maintenance of fluid balance. Glomerular filtration rate, it plays a key role in maintaining body fluid balance. This is done by controlling the volume of filtrate formed. The kidney, it can regulate the amount of water that is excreted through the urine. So that is the urine volume. An increase in glomerular filtration rate, it is leading to increased urine output. And if the GFR is low, a decrease in GFR takes place, that is, it conserves water and decreases urine formation, thereby helping it to maintain a hydrated condition and also blood volume. Fourth one is regulation of electrolyte balance. The filtration process, it determines the amount of electrolytes entering the renal tubules. A proper GFR, it ensures that the ions or the electrolytes such as sodium, potassium, chloride, their levels are maintained at optimum concentrations. Any disturbance in the GFR It can disrupt this electrolyte balance, and this in turn affects various physiological functions. Maintenance of blood pressure. Glomerular filtration rate, it is also closely linked with blood pressure regulation. The kidney, it can adjust the GFR by altering the blood vessels diameter and through hormonal mechanisms such as release of renin. These adjustments, they can help maintain stable blood pressure and adequate circulation. Sixth one is role in acid base balance. The kidneys, they play a vital role in maintaining the acid base balance in the body. The glomerular filtration rate influences the filtration and subsequent handling of the hydrogen ions and also bicarbonate ions. Proper filtration, it removes all the excess acids and it helps maintain a pH, adequate pH, so that the body fluids and even the normal limits are maintained. Normal limits of pH, not acidic and not basic. Prevention of protein loss. A normal GFR, it ensures that the filtration barrier at the level of glomerulus, it remains intact, preventing any leakage of protein into the filtrate. So if the filtration mechanism is damaged, you see that there is protein which may be leaking into the filtrate, and you can also see protein in the urine, a condition which we call it as proteinuria, which is a sign of kidney disease. Eighth one is clinical importance in disease diagnosis. Glomerular filtration rate, it is widely used in the diagnosis and telling the stage of a kidney disease such as acute kidney injury and chronic kidney diseases. Based on the GFR values, the severity of kidney dysfunctioning can be assessed, allowing appropriate treatment strategies to be planned. Ninth one is drug dose adjustments. Since many drugs are eliminated through the kidneys only, GFR is an important factor in determining the drug dispose or the drug elimination from the body. In individuals with reduced GFR, the drugs may be getting accumulated in the body, leading to toxicity. Therefore, dose adjustment, it is done, and it is very much necessary to ensure safe and effective treatment. Consequences of abnormal glomerular filtration rate. We have two consequences. One is the decreased GFR, the other one is increased. So under decreased conditions, we shall see a decrease in the glomerular filtration rate may occur because of kidney damage or even due to reduced blood flow, or it could also be obstruction in the urinary tract. This leads to accumulation of waste products, even fluid retention in the body, and electrolyte imbalances also. All these can severely affect the overall health. Next condition is increased glomerular filtration rate. An increased GFR, it may be seen in certain conditions such as in the early stages of diabetes. Although it may initially enhance filtration, prolonged evaluation can damage the glomeruli and impair kidney functions over time, with time. Let us summarize what we have studied. Glomerular filtration rate, it reflects the kidney functioning efficiency. It mainly measures the rate at which the blood is filtered at the nephron. Glomerular filtration rate determination, it is very important to understand waste removal and homeostasis. GFR, it helps regulate fluids as well as electrolyte balance. Clinically, when you observe GFR determination, it helps in diagnosis and even to monitor diseases. So a normal glomerular filtration rate, it is essential and changes require timely evaluation. Recommended books for further study include Guyton and Hall Textbook of Medical Physiology, Essentials of Medical Physiology by K. Sembulingam and Prema Sembulingam, or Human Anatomy and Physiology by Elaine and Merab et al. Or you can study Review of Medical Physiology by Barrett, Susan, or this is the Indian other one, Textbook of Medical Biochemistry and Physiology by M.N. Chatterjee and Rana Shinde. Thank you.